COVID-19 or coronavirus is here, so it's important to have the correct information at hand, like knowing the symptoms, a high temperature, a cough, shortness of breath or breathing difficulties. If you have symptoms, self-isolate to protect others and phone your GP. Visit hse.ie for updated factual information and advice, or give us a call. Protection from coronavirus. It's in our hands.
Changing your newborn's nappy is one of those things you'll be doing 7 or 8 times a day, so it's best to be organised from the start. Make sure you have everything you need ready and close to hand. Place your baby on a clean, soft, flat surface. Open the nappy and wipe away excess stools from the genital area with the corner of the nappy. Hold your baby by the ankles and lift up their bottom. Use soft cotton balls or a wet cloth to clean your baby. Clean around the umbilical cord area. For a girl, be sure to wipe from front to back. This will help minimise the spread of an infection. Swap a clean nappy for the dirty one. Use the tabs to see which way goes up. Avoid covering the umbilical cord as this can cause irritation. For a boy, keep his penis pointed down. Fasten the nappy at both sides with the tapes, making sure it's snug, but not so tight that it pinches the skin. Retape the soiled nappy around the contents, put it in a plastic bag and discard it in the bin. Dress your baby and wash your hands thoroughly. Babies wet their nappies several times a day. The number of wet nappies is a helpful sign of how much fluid the baby is taking in. Generally, a baby should have 5 to 6 wet nappies each day. This is a good indication that they're getting enough milk.
Every year, thousands of children are affected by illness or injury, so knowing what to do is important, especially if you're a parent. When a child is sick or hurt, it can be a very frightening experience, but how you respond is vital. Basic first aid can often prevent the condition deteriorating or becoming life-threatening. The aim of these short videos is to give you the basic knowledge and skills to know what to do if your child is sick or injured. How you respond in an emergency situation could make the difference between life and death.
In Ireland, constipation affects 1 in every 3 children. In 95% of cases, there is no known reason for it. This is known as idiopathic constipation. If your child is passing hard, dry stools with difficulty, less than 3 times a week, they may be constipated. If they are also having frequent accents, they may have impacted stools and are experiencing overflow diarrhea. This can be viewed by some as bad behaviour, but in fact the child has no control over this. If constipation is left untreated, it can lead to anal tears, which cause the child pain and in turn lead to holding onto the stool. There are some key points to remember. Know the different types of stool to identify constipation with or without overflow diarrhea. Type 3 and 4 are normal stools, Type 1 is constipated, and Type 7 with Type 1 is constipation with overflow diarrhea. Impacted stool must be cleared out with higher doses of laxatives as prescribed by your doctor. After this clear out, maintenance medication must be taken to prevent a build-up of stool. A common misconception is that laxatives may make the bowel lazy. This is not true. Keep a diary for a week and look at how much fluid and fibre they are consuming. A typical 4-year-old needs over a litre of fluid and 9 grams of fibre a day. Your child should be sitting comfortably on the toilet with an insert and footstool if needed. Feet together with knees level with the belly button and elbows resting on the knees. Gentle pushing down can help the stool out. Blowing bubbles and balloons can cause enough pressure instead of going red in the face. Encourage your child to move around. Exercise of any kind is better than sitting in front of the telly. It will really help the bowels to move. Children that experience hard stools that are sore to pass will often hide in the corner and avoid the toilet. Keeping the stool soft will help and eventually the child will forget the pain, but this will take time. Early detection of constipation is a must. Treatment takes time and effort. Talk to your GP about any concerns that you have.
When you and I get a cold, we tend to have a stuffy nose, we might have a temperature and we might have a slight cough. It gets better in a few days. If a small baby gets a cold, it can go down onto their chest and we call this bronchiolitis. So they start with the stuffy nose and the runny nose and then they develop a cough that seems to last sometimes forever, but generally it gets worse for about the first 3 or 4 days. The next 3 or 4 days are when you feel really worried because your baby doesn't seem to be getting better, but that's a normal pattern. And then after that, the baby gets better slowly, though sometimes the cough can be there for up to about 4 weeks. It's usually caused by a virus, so no antibiotic or medicine will help you get better faster. We usually recommend is that you just mind your baby, not too much handling, feed them little amounts and often, and they will get better by themselves. Some babies do need to come into hospital or do need a doctor. Key things to look out for are if you're just worried about your baby, if they're pale, if they look grey, if they look blue or tired or sweaty, if they're not really interested in their surroundings as much as they normally are, if their breathing is very fast or if they're having episodes where maybe they're even stopping breathing, or if you notice that they haven't had a wet nappy in a while. If you're worried about any of these things, just pop into your doctor or bring them to your local hospital.
What you would do if you're in the situation at home and your baby appears to be choking. This is a situation that we hope you will never find yourself in, but there are a few simple steps that you can take which will really help. You will recognise that your baby is choking because your baby may appear to be crying but no sound coming out, and coughing but absolutely no sound. So what you do is pick the child up, put them across your knee with the head slightly low, and with the heel of your hand give 5 sharp slaps in an upward motion, 2, 3, 4, and watching the baby to see if anything comes out of the baby's mouth, and give 5. Keep a close eye. If nothing comes out, there's no response, turn the baby over, and now you're going to give 5 chest thrusts. So with 2 fingers, again pressing in an upward motion, 1, 2, 3, 4, 5. If still there's no response, repeat again your back thrusts, watching to see if anything is going to come out of the baby's mouth. Again, 1, 2, 3, 4, 5. Don't be worried that you're hurting the baby. It's really important to give a good thrust. Turn the baby over again, and with your chest thrust, 1, 2, 3, 4, 5. You would repeat this 5 times. And if there's no response from your baby, obviously call emergency services as quickly as you can and get help on the way.
For parents, one of the most frightening things that can happen is that their baby stops breathing. Follow these simple steps to administer CPR. Gently stimulate the baby by tapping the foot or squeezing the hand. Shout for help if there's no response. but remain with the baby. Gently tilt the head into the neutral position to open the airway. Have a quick look in the mouth to see if there is anything visible. If there is, lift it out. With the head in this position, check for breathing. Look for a rise and fall in the chest and tummy. Listen for breath sounds. Feel for air from the baby's mouth on your cheek, taking no longer than 10 seconds. If your baby's not breathing, give 5 rescue breaths by blowing gently into the lungs, covering the baby's nose and mouth, ensuring there is good seal and you can see the chest rising. Each breath you give should be approximately 1 second in duration. If there are no signs of life, example eyes opening or limb movement, the baby's heart may not be beating properly and you must begin compressions on the chest. Place the tips of 2 fingers on the lower half of the breastbone and push the chest down gently but firmly to a depth of 4 centimeters. Push fast for a count of 30. Then give 2 breaths, followed by 30 compressions. Continue this sequence for 1 full minute. After this, if you are still on your own, make a call to the ambulance stating your emergency. Return quickly to the baby and begin with compressions, alternating breaths as seen, until the baby responds, or you can hand over to the ambulance.